just got out of a meeting with progressive Democrats and caused quite a stir with my preaching about Jesus. Now, I am for the health care for all, but, you know, I'm also against Islam and those types of things, and well, you'll just see what happened. Please share this video, and if you'd like to join my Facebook group, Homeless Advocates for Christ, and also Christians United Against Islam, and just pray that my ministry will grow and draw more people to the Lord. Thanks so much for your prayers and support. I forgot to add, please pray everyone gets the health care they need in USA. Thanks a lot.
So why would you reject Jesus? Why would you reject Jesus?
I don't believe in religion. I think religion's absolutely fucking stupid.
What about Jesus?
One of the problems in this world is religion.
What about Jesus?
I don't believe in Jesus. I don't believe in none of that shit. And I know the Bible twice as good as you.
Have you sinned? Do you believe you've sinned?
Hell, you create the sin, not God.
Have you sinned?
Because you do it. Because you're a man. I'm a woman. A man or woman, whatever.
Yes or no? Have you sinned?
Do you think God sin came from God?
All have sinned. All have sinned. All need a savior.
Stupid.
You
so
need
you're
a savior.
sin on God.
I'm saying you've sinned. I've sinned. We all need a savior.
We do.
Yes.
Jesus, my savior.
A bad word
is
is sin.
Shit. I don't believe in Jesus. I don't believe in God. I think the Bible's absolutely fucking stupid.
So how do you not understand?
I create my own morals. Okay. I don't need the Bible to create my.
Let me tell you this.
Wait a minute. Let me finish.
The Quran has rules. Kill the infidel.
The Bible teaches morals. If you think the Bible teaches morals, you're full of shit.
Love your neighbor as yourself.
Killing women.
Love your neighbor. New Testament doesn't say that.
The Bible does. The Bible says.
New Testament does not say that.
Oh, what about the Old Testament?
We're Christians.
What about the
New Testament.
What about the old one?
We're not in the Old Testament as a Christian.
Oh,
you can't do both covenants.
Like the good part.
You can't do both covenants. That's for the Jews. I'm a Christian. I'm a Christian. New Testament. You don't even know the Lord. You need to repent. That's it. I'm a humanitarian. Yeah. But I'm a Christian. Islam leads to hell. That's the truth. You just hate the truth.
I want to make an announcement. AB 1298. This is co-sponsored by Miguel Santiago and Assemblyman Lackey. This bill, it passed down. He shot someone like in Texas. He shot the car that was coming towards him, and he killed the boy inside. He put in his report that the car was charging him. Guess what? The car wasn't charging him, the car was going the other way.
Right.
In this bill, if that officer makes that mistake in the state of California, if this bill passes, he can't be prosecuted.
What's the bill number again?
AB 1298. It's called Public Safety Officers Procedural Rights. You ought to read that bill. After one of the bills they eliminated, people, if you witnessed an accident, you couldn't testify. It was in the bill. They had to eliminate. Read the bill.
Yeah, okay. Just so you guys know, some of you that maybe don't know, I'm the founder of the Facebook group Homeless Advocates for Christ. I'm very much a humanitarian, so just want to correct you on that.
Okay, everybody, let's go.
Airbase, Assad Air Base, and that was actually the first direct U.S. attack on an Assad target in the 6-year conflict. Anything before was targeting ISIS, but not the Assad regime. There were, of course, that's beside the funding or weapons that were given to rebel groups that targeted the regime. So there's no end in sight. There are peace talks.
Do you believe in that attack? You think it was right or wrong?
The attack was.
Yes or no answer? He has an answer.
I don't know the answer.
That's right.
I don't know the answer. Okay. Because at the end of the day, the attack didn't do him. If he didn't do him.
That's right.
So there are peace talks every now and then. Right now, there are peace talks being held in Kazakhstan between Assad, the regime and its backers, rebel groups and their backers. But there's been peace talks that have been happening for the past few years, and it seems like it's just another conference that with no outcomes. It's kind of reminding me of peace talks between Palestinians and Israelis for decades, with no end in sight, with no solution, with no real political will to end the conflict. I feel that the only way to end the conflict is that the backers, Syria's war is now a proxy war, has been a proxy war. So the only way to end it is that if the backers of each faction are willing to end the conflict, willing to stop. So you have, and I'm talking about 4 countries mainly, global and regional powers. So that's the U.S., Saudi Arabia, Iran, and Russia. And it doesn't seem like any of them is willing to compromise for the most part.
I had a question about European. Now I'm a Christian myself. I'm not for Islam and, of course, ISIS either.
I'm actually from a family of my father's Muslim and my mother's Christian, and no one declared jihad on anything.
Okay, well, yeah. The thing is my question, I guess. Do you think how do the weapons companies play in all this? As far as for them, war is profitable, so they don't want to stop the war. They want to keep the war going, I would think, right? So, do you know anything about that, or?
That's the main reason why it's not stopping. You know, U.S. weapons companies are benefiting from the war. A lot of people are benefiting from the war.
Why did you say you were a Christian? What's that got to do with anything?
Why say I'm a Christian?
Why did you say that? That has nothing. Religion is the biggest
Well,
problem in
because
the world. Religion is our biggest problem.
religion isn't a problem.
Okay,
False religion is a
Let's
problem.
get back to
Jesus
this
is the
topic.
answer.
Let's
Jesus
get-
is the
we
answer.
can have- I think the
Because Jesus is the
Democrats
answer.
wanna-
We need to get back to the
Okay.
question.
Okay, so as far as what we can do, yeah, usually if I want to give a talk about something, I'll have like a specific bill in mind, the way Dr. Bill presented. But there's here as Americans, well, there's a bill that some Syrians were advocating for. It's called the Caesar Bill, basically to impose a no-fly zone. I don't know how effective that would be. But the other thing is regarding refugees. And right now, this is the worst refugee crisis since World War II. Well, the death toll so far has been over 400,000. So close to 500,000 people in 6 years have been killed. And, you know, the world powers are contributing to it instead of stopping it. And there are over 5 million Syrians that are refugees. 5 million. So the total population of Syria used to be 20 million. 5 million of them are refugees outside the country, and then over close to 7 million are internally displaced. So more than half the population is either refugees or displaced or dead. And the violence isn't. It doesn't look like it's ending anytime soon. And most of these refugees are not in Europe or in America. They're in the surrounding countries, in Turkey, in Lebanon, in Jordan, and even in Iraq. Imagine Iraq is taking in refugees. Iraq that's been at war for a long time is taking in refugees. And here we are complaining about whatever small number that we are taking in America. The U.S. Last year took in about 100,000 refugees, and that's not Syrian refugees. The top countries that we're taking are from Iraq, Iran, Afghanistan, Armenia, and then Syria.
Last one.
The Armenians, and then Syria.
That means how many thousand Syrians? Not too many, huh?
No, not a lot. And
Why is that?
I'm sorry.
Why is that? Why are they not taking
They're
It's, I know why it is, because of the things they're making.
there's
They're branding them.
yeah. There's you know, there's a lot of Syrians that became refugees. Most of them are Muslim, but many
Who cares?
are Christian. But who cares? And we keep hearing about the vetting process, that we need a stricter vetting process. But the reality is that there is a strict vetting process. It takes 18 to 24 months for a refugee to apply. I'm talking about America.
Yeah.
For refugees to apply to come to America until they actually make it here. And they go through the UN first, and then State Department vets them, and then Homeland Security, and then if there's any concerns, they go through the FBI Counterterrorism Office.
And many Christian organizations are stopping those kids from coming over because they're Muslims. Many Christian organizations.
Yes, and then there are many Christian
Well-
organizations that are actually helping because, you know, for
Well, there's
Prejudice.
well, Islam is a dangerous religion though also, so that's why.
I'm sorry?
Islam is a dangerous religion.
No, it isn't. No, it
Anyway,
isn't.
Yeah.
Josh, no, it isn't.
What the damage Christianity has done in this world is unbelievable.
True Christianity is about love and holiness.
topic.
Let's get back to the subject. Thank you.
Did you have a question?
Kill the infidel. Remember the Quran says, kill the infidel. Remember that.
Josh, you're wrong.
That's what the Quran says. I'm just saying what it says. It says kill the Christian, kill the Jews.
Struggle against evil, which is what's in your mind right now. That's evil.
I hate the lies of Islam.
Excuse me, everybody. Excuse me, everyone. Excuse me, everyone.
Only Jesus saves. That's it.
We need to get back to the speaker because I said before, please do not interrupt the speaker because he only has about 10 more minutes, and I want to make sure that he gives his full amount of information that he has for us. So please, stop. Thank you.
Thank you.
No, Rashad, of the 5 million refugees, do we know how many are Christian?
We don't,
Is there an estimate?
more than half are children.
Yes.
Actually, 2/3 probably are children and family, because most of the refugees, there's a lot of men that are fighting, and then their families are leaving. Obviously, the first victims of any war are children, and that applies to in Syria. When after Trump became president, he cut the number of that low number of refugee resettlement to the U.S. from 100,000 last year to in half. So it's, this fiscal year it's supposed to be 50,000, and just to put it in perspective, California in the fiscal year 2016 took in less than 7,000 refugees. Actually to be exact, less than 8,000. So 7,908 refugees came to the state of California in the year 2016, in the fiscal year 2016. And I'm not talking about Syrian only. So the number of Syrian refugees is a small fraction of that number. So as far as what we can do, refugees resettlement is an issue that we need to. It's our moral duty to take in more refugees. There are laws to make sure that they are vetted. In fact, most Syrian refugees that come to America are like the top notch of. They go through a long process, and the U.S. government will not take anyone. Exactly.
Damn
So
right.
they're highly educated, and the only problem is once they come here, it's tough for them to integrate. So there's a long process to help them integrate. They usually lose everything they have
Yep.
before they make it here. They have a little bit of money, but they lose most of their belongings. So they come here, and then there's another few years of reintegration. There are refugee resettlement agencies working locally to help refugees. World Relief in Garden Grove. There's Access in Anaheim, IRC in LA. So we as a community should support resettlement agencies to help with this process. But what we should advocate more is to tell our members of Congress to increase, to vocalize their support to increase the number of refugees that we admit here in America. It was already a low number, and it was cut in half. So that's something that we should work on. So I don't know if there's any other questions, but go ahead.
Well, I have one. I like the fact that you pointed out that really, right now there's been no military solution, like say the no-fly zone or redlining anything or launching a bunch of missiles at an air base and finding out it didn't do anything. So, and not to mention the fact that nobody knows who the players really are, and that we're supporting rebels that will then later attack other groups, you know, that we support, and like you said, in Turkey and all of that, and the Kurds. So, you know, I would think that I am aware of legislation. Representative Tulsi Gabbard from Hawaii. She is a two-time Iraq veteran that feels she's put forward legislation to end. She calls it end regime change operations. So, like for example, this gas attack. If it's perceived that it was Assad who did that, then that is an effort on the part of the United States to change that regime. And so if her legislation went through, that would be Congress saying no, to the president, not just the authorized, what is it, AUMF, the authorization of use of military force, which they have subverted, but we stopped. Barack Obama had at one time considered doing that, right, for a previous gas attack, and Congress actually stopped him from doing that, during his presidency as well. But I just wonder, if you're aware of that legislation, and that would be another piece in terms of the refugee support as well.
I'm aware of that legislation, but that legislation wants a hands-off approach to the conflict in Syria. So that will not end the conflict. That's basically telling the U.S. not to get involved, because whenever we get involved, we're supporting rebel factions that may not be friendly to the U.S. and I don't think they are. But so she looks at it from she calls all the rebel factions terrorists, and that's problematic too. I don't see that. I mean, the thing is, Tulsi and some Tulsi's considering the situation in Syria like the way we invaded Iraq, and there are many differences between them. I view it as we must end it now, because when history tells us that, I mean, this is just another Rwanda, another Bosnia, another, we're at 500,000 people dead and half the population becoming refugee. That's a concern. It's not a state, a regime that's fighting. It's not simply a regime fighting terrorists, and then we're getting in there to support terrorists the way Tulsi is framing it. That's why I find that legislation problematic.
I like what you said, and I completely agree about the moral responsibility to take in the refugees. And what really frightens me about everything that's going on right here and the division in this country is the fact that half the country is turning their back on it, which is the characteristic that has made this country the beacon of light in the eyes of the world. Okay, we've always done it. In fact, the fact of the matter is that is our strength, is diversity. And why half the country is so afraid. And I get it, because people they're afraid of what they don't understand. They're afraid of anything that's different. Well, you know, I've had the privilege of being able to travel outside this country. Our system, as great as this country is not the only system out there, okay? There's a lot of people out there. Everybody puts their pants on one leg at a time, okay? And so I completely agree with what you said. It is our moral responsibility, okay? I asked somebody who objects to that, what would you do if it was you and your family that were the refugees? All you want to do is you want to live. You want to see another sunrise tomorrow. That's all you want to do. You want a future for your kids, okay? And that's why I'm so opposed with what's going on, because, you know, in this country, because I don't really care about my future. This right now is my future. I've lived more of my life in the past than I will in the future. I'm worried about the future for my kids, and not just my kids, but everybody out there, okay?
So, I disagree with the attack. And I know chemical war is bad, but I disagree on the attack, because it didn't prove a damn thing. It didn't end anything. And I am a firm believer in bringing refugees over here. I don't give a damn about color. I don't care. I don't care. But 90%, and if you go to these Christian organizations, 90% of these Christian organizations you see on TV every single night, you know what they say? They're Muslims. We can't have Muslims in the country because this is a Christian country. It was not a Christian country. It never has been.
Can I just
but
respond
what
to one
bothers me
thing?
is these people that in Texas, I read right before I came here in Texas, right today in Texas, these Christian groups in Texas, and this is, I read it today before I came here. I was telling Dr. Bill. Jews cannot adopt, Muslims cannot adopt, gays cannot adopt, everything. And they're passing a bill in Texas. 5 other states have this bill. Muslims can't adopt kids. Yeah, it's today.
Let me just say something. One thing for let me just answer for. I'm the minority. Well, this is all it is. This is all I want to say. Christians are afraid of the Muslim ideology that's in the Quran.
I'd be afraid of Christians.
And we should be.
Before I'd be afraid of Muslims.
Because it says kill the infidel.
Theological debate here.
Okay, everybody. Thank you so very much. Thank you.
Question a week later. Remember what he said? 5 or 6 million. I mean, talk about the divide, the gulf, right? So this is not, you know, this ophthalmologist's idea of rich. But, you know, they value their primary care more than their specialty care, especially these procedure doctors. When you look overall at what's the national sentiment for a single-payer Medicare for all system, the most current figures here from 2015 shows that it is still a vast majority, 58% of people would like to have Medicare for all. You look at Democrats, it's almost, you know, beyond that, 81% of Democrats recognize that Medicare for all would be the fix. You look at doctors, remember they all say, oh, doctors are not going to stand for this. Wrong. In fact, we're seeing the AMA coming closer now. Now, how many? What do you think? How many practice or what percentage of practicing physicians in America you think belong to the AMA, the American Medical Association? We all belong, right? It's like some fraternal order or something. You know, we have to belong or something. Professional society. 15%. Only 15%. I know. I get this everywhere. But only 15% of practicing physicians belong to AMA.
You don't hear that figure from them.
Why is that? Yeah, why don't you get that figure from them? Because they don't represent the vast majority of us. They represent those procedure doctors. And they've kept those specialties rare. It's called rarefication, you know, in economic terms. They've kept it rare so that commodity, you're going to pay more money for that commodity by keeping it rare. So the AMA doesn't stand for me. They're getting a little closer nowadays because, you know, people are recognizing that the big baddies here are big insurance and big pharma, and they need to take a stand with the people instead of them. So you look at doctors back in 2002, we were strongly or generally in favor of a single payer of Medicare type system. By 2007, it was more than this, obviously more than half. You look at the primary care specialties, that number is about 75% of primary care doctors wish we all had Medicare. When you look at ER doctors, that number is 90%. 90% of ER doctors would like to have everybody have insurance the minute they walk in. Doctors are going to get paid, the hospital is going to get paid. But even better, we know that people had a plan, and so they aren't coming in for junk stuff that they couldn't get taken care of elsewhere. Okay, so let me just cover a few things about the Affordable Care Act. The number of uninsured dropped from like as high as 20% down to about 10%, and with that, you saw commensurate, positive changes. What were the drivers behind it? Young adults could stay on their family plan, as we say, no exclusions based on pre-existing conditions, and state exchanges and were set up, and the Medicaid expansion, of course, which a lot of states opted out of. Thank you very much, conservative Supreme Court. Scalia lives on. So what happened as a result? The preventable death rates dropped by half. Is it gone? No. We still have 30,000 per year who are dying preventable deaths in America. And the medical bankruptcy rate didn't change at all. Didn't change. We're still the #1 cause of personal bankruptcy. Here we are 7 years after starting the Affordable Care Act. So these are the drivers for further reform. Should we be happy? Should we be complacent and just say we're fine with the Affordable Care Act? No. We need to do more and better. And we can do more and better like I was showing you. So the Republicans want to repeal and replace, they want to end Medicaid expansion, bad idea, dropping a whole lot of people off health savings accounts and tax credits. That's great for rich people. If you have money to put in a health savings account, great. Who's got money to put in there? Not me. Tax credits, that's great. Again, if you're rich, you'll get more, refunds back on your income tax. Okay, that's not for most working people. We fully expect the preventable death rate to double again, and the costs will continue to rise. There's absolutely no cost control whatsoever. So what are the real fixes? John Conyers at HR 676, I mentioned. And you can go to this national website, healthcarenow.org, for more information on a national fix. And then down here is our wonderful illustrious California SB 562. If you didn't get a flyer, anyone else need a flyer on SB 562? But it says that everybody in California will have health care. It's a universal health care plan for all California.
Do you have one on the Conyers HR 676 flyer thing at all? No? Okay.
You can go to Healthcare Now.
Okay.
And get all the information on that. And our website, on your flyer, please go to this website, healthycalifornia.org. It's on your flyer. And sign up. Sign up so that you can be in the loop. We just got it through Senate Health Committee. Yay! Big step. Okay. Next step is California Senate Appropriations Committee. That's huge. But getting it through a Health Committee was huge because we had Democrats who waffled on it, or were waffling on it. And the last time we tried to get this through, we had 6 Democrats who blocked it. And all of them said, oh, Jerry Brown said we shouldn't do it. He doesn't want to sign it. He doesn't want to have to sign it. Jerry Brown said, no, Barack Obama wants us to not do anything because he wants the Affordable Care Act to go in, fully in effect. We've seen it now. We've seen the results of Affordable Care. It's better, but it's not good enough. But we had 6 Democrats block it last time, 5 Latinos, and 1 African American. Why would they do that? Including Lou Correa.
Yeah.
Why would they?
Is the lawyer still in?
No. Who can tell me why? From communities of color, why would they block it?
Cost.
Money.
Yeah.
Money. Because they're taking big bucks from big insurance and big pharma. And they have to do that in districts that don't have big other private donors, right? So in other communities that are wealthier, Democrats can get money from wealthy contributors. But in areas where they don't have the big bucks, you're going to have to raise money like Bernie Sanders did, you know, $27 a person kind of thing, to fight off. The Koch brothers are going to get somebody to challenge, you know, Lou or someone else in this area. So I can tell you, you know, of those five Latinos and one African American, 2 of them are in jail. 2 of them are now in Congress. One of them is our Secretary of State, and one is the revolving door, is now a high-paid lobbyist. So this is political, you know, bad stuff at its worst. And we as activists, as political activists, need to say, no, we need to resist. And the way we do that is to push forward with this bill. This financial study that's going to come out and lead it into appropriation, I can tell you, far back in 2004, this group, a very respected financial institution called the Lewin Group, found that it saved money for employer groups. See the way the bars go down? That means it costs less money. It saves money for all employer groups. Because we're tied in with employment, we'd be untied from employment anymore. So employers would no longer have to provide health care for their employees. And that saves big bucks, okay, to all employer groups. You have small, medium, and large. And the large employer groups save the most. But why won't they go for it? Because of something called the U.S. Chamber of Commerce, which is tied in with big insurance. So they're not going to allow that to happen. They like things the way they are just fine, okay? It's going to be small and medium-sized employer groups. And so if anyone can show a friend with a small or medium-sized business, this movie, Fix It, and that will show them and say, sorry, U.S. Chamber of Commerce, our local Chamber of Commerce is going for this single-payer bill. The city of Santa Monica studied this back in 2009. They found they would save $6 million a year by going to a single-payer system. That's a lot of money, right, Dr. Moreno? That's a lot of money in the city budget. $6 million a year they would save, okay, if they went to a single-payer system. The state of Vermont would save $5 million for their 500,000 population. I mean, we have, what, almost 2 million people in Orange County alone?
500 million. You said 5 million. 500 million it says there, right?
I'm sorry, 500 million, right. $500 million for their 500,000 patients. And that's a true indicator anywhere you go. Okay, so you can, as a state, in California, we have how many people in California?
Many.
34. 38, I think now, 38 billion people. We would save 38 million people, we would save $38 billion a year in our state budget, just by the number of state employees that we have. But all businesses would save money, too, because they're no longer tied, healthcare is no longer tied to employment. It's based on a progressive taxation system. So locally, this is our campaign here in California, the Campaign for Health in California. I mentioned that. And then this is our new champion, Senator Ricardo Lara. If you haven't seen him at, like, say, at the Senate Health Committee, he's brilliant. This guy, I had no idea that he's that brilliant. And he, you know, led the discussion there at the hearings. And then also there's Senator Tony Atkins from San Diego, Michael Leidy, who's the policy director for National Nurses United and California Nurses Association, was their expert witness on the pro side. On the opposition side were some industry baddies like Kaiser, for example. I worked for Kaiser for 30 years. How can you work for Kaiser? Yeah. So, but anyhow, they were certainly, you know, it was a fiery discussion, and it's worth watching. And they had this phenomenal parade of individuals who came all the way to Sacramento to say that they were in favor of the bill. And then, you know, of course, 3 people in suits come out to say they're opposed to it. I can tell you that we lobbied Josh Newman, Janet Wynn, John Morlock. I've been to meetings with their staff locally, all of them so far. We have one coming up with Pat Bates. Josh Newman waffled on it. Josh Newman abstained from voting on this. Says he wants to see the financial, you know, projection. I'm happy to show him my PowerPoint. Everybody in here is now smarter than Josh Newman on the subject, because, you know, if it's true, and I always say when you know, and I think Sharon Court Silva said the same thing. You know, if it's true that they don't know, then they're, you know, I'm sorry, ignorant on the subject. Or they're lying. And that either one of those things are good. And we want them to be, you know, smart and in favor of these things that will benefit the people.
What's that window on it?
She voted no. She's an absolute no.
I think
Okay, two Republicans, there are only two Republicans on the committee, and they both voted no. Josh and another Democrat abstained altogether, but we got 5 votes, which was the majority, including Senator Ed Hernandez, which is not, he has not been found previously, and now he's running for lieutenant governor, and I highly recommend you go to his website and consider endorsing Ed Hernandez. Now, he's become a champion.
John just wants to see what the financial mechanism in the bill, exactly how it's going to work.
So,
and that's not worked out yet.
The legislative process is you go through the policy stuff first. That's what a health committee is policy. Then it goes to appropriation. So the financial has to be done before appropriation. That's the money. That's where you work out the financial stuff. So I'm sorry, I don't accept that as an excuse for him not voting for it, or Janet Nguyen for that matter, because it was just a matter of policy. Is this a good idea for California? Absolutely. Could it be blocked in appropriations? Sure, if the numbers don't work out. We have a financial study done right now by an analyst who's very friendly with Jerry Brown. They were chosen because they're friends. And so we expect the numbers to come up, as they always have, in our favor, that it will save money. As you know, single payer saves money. Okay, so the numbers will come out in our favor, and then they're going to have to find another excuse to not vote for it by the time of appropriation, or when it goes to the Senate floor, and it can be blocked at either point now. So Josh didn't have to waffle on this. He could have supported it in concept, the policy of it, and didn't. In my opinion, I think that was a mistake, and we told his staff that 10 days before the vote, that we thought he should be a champion for this too. But once this is passed, it will go to the Assembly, in which case we will want or expect Sharon Silva to do better.
Now you're talking about
And
562.
I'm happy to sit down with her anytime. Pardon?
You're talking about 562.
SB 562. Yeah,
About Tom
the Healthy
Daly.
California Act.
Dr. Bill, about Tom Daly, where is he on the
Don't know. So we haven't
Tom
moved.
Daly.
Yeah. So when you go to the website healthycalifornia.org and sign up, you'll be part of the you'll be in the loop as to what the next strategic point is. And so right now we're going committee by committee. We're way far away from the Assembly at this point. We're encouraging people to contact their Assembly members and ask them that same question. I guarantee you they'll dodge it. No, we have a few co-sponsors already from the Assembly side. If you look up the legislation, you'll see there are a few co-sponsors already. He's not one of them.
Bill,
Yeah.
I say that is he on board?
Not that I know of. He's not one of those he's not a co-sponsor, and he's not on this committee. I think he may be on appropriations, but he was not on health. Yeah.
What was the answer about Bailey?
Don't know yet where he is. And he's on the Assembly side, and that's a ways away yet. But, they expect the floor vote. The appropriations will be at the end of this month, and the floor vote will come up the first part of June. So, I mean, now is the time to call Josh, if you live in his district especially. But even if you don't, these folks are voting for things that affect us all. So when they tell you, oh, you don't live in the district, you just say, I don't care, I live in the state. They're voting on a statewide law. I'm going to give you my opinion. And they'll usually back down at that point and take your opinion. Yeah.
Like when you're talking about healthcare, to me, the big thing is, how do you pay for it? That's been the downfall of the Affordable Care Act. Everything.
Yeah, that's the Thanksgiving dinner question, like your Trump voter uncle, Billy Joe, he will ask you the same question, right? How are you going to pay for it? What's the answer?
How do you pay for it?
What's the answer? It's the free calendar's pie. We're already paying for it. We're just not getting what we paid for.
Yes, but how are you going to pay for it? I mean,
we're already paying for it. So when you apply the money that we're already paying in terms of private and public insurances, then that pays for not only what we get now, it will also cover dental, mental health, long-term care, all those things that we don't get now. That's how. So now, if you're talking mechanism, It's a
mechanism.
It's a progressive taxation system, meaning by ability to pay. So those who have done well in American society, you know, in our capitalist system that we have, they're going to be expected to chip in more.
Okay.
So it's income tax and payroll tax, at least in this state.
The other half is, says
I think I've gone over my time, so I got to, and I know everybody wants to talk.
But this is a simple question.
Yeah, go ahead.
It appears to me that this represents destruction of the entire healthcare system.
No, absolutely not. It does not. It destroys the payment side, which we have allowed these banditos to control. So that's just the payment side. Doctors, nurses, hospitals will function exactly the same way. Kaiser would function exactly the same way.
So we will still use the same delivery?
Not only that,
system?
you will have free choice. There'll be no more in-network provider stuff. You can go see any doctor. You can go walk into any hospital and expect to get care. You can go to, you know, anything. If Kaiser's such a great model for providing care, then they can compete based on the care they give, not on some insurance product they offer. Okay?
Okay. Thank
Sorry,
you.
I have lots of questions.
Now, Canada transitioned to this system in what, 60s or thereabouts?
So they passed it about the same time we passed Medicare for seniors, they passed Medicare for all. So it's
prior-
mid-60s. By 1970, you saw, was when they fully enacted it, about 5 years later. And none of this we're doing for ourselves, by the way, if you're, you know, old like me. I see a few young people here. Most of, we're doing this for young people because it'll take a while to transition.
So prior to that, they had a system similar to what we have
Yes.
today? Okay. So what was it? What was the catalyst? What
got, you know, so watch this movie, the healthcare movie. It's all about that. It's a wonderful a preacher from Prairie Province, Saskatchewan, named Tommy Douglas, who started this in the 30s, and by the 60s they got it.
And recently he was voted the best, greatest Canadian of all time, wasn't he?
Right. Because he recognized that it wasn't right, it wasn't morally right. This is not about right versus left, it's about right versus wrong. This is actually non-partisan, this is where right and left meet around back, okay? And he recognized that, and Republicans, conservatives, you know, like their system too and value it too. You know, you saw that in Michael Moore's movie. This guy on the golf course said, you know, Michael Moore asked him, he said, "You're a conservative, why would you like the public health plan?" He said, "Hey, how do you think I got rich? I know a good deal when I see one."
I have an acquaintance I know that lives in Canada, and she had a torn meniscus, and she wanted to get it done. And because there was such a waiting list and time, she ended up coming down here and having it done.
Yeah, so, sorry,
How does
but
that all work?
overall, they don't wait any longer than we do. And you will hear stories like that over and over again. And I realize it's averages and stuff, but they don't wait any longer than we do. And you saw they live longer than we do. Okay, so it might apply to having your knee fixed or your hip, you know, done, replaced or whatever. You know, but overall, they live longer and have better health outcomes than we do. And if they were waiting longer for their care, would they have better outcomes? No. So I can tell you that as an emergency doctor, there are things you can wait for and things you can't wait for. And when it's the people deciding what those things are, instead of, you know, some corporate bottom line, then you can do a whole lot better. And we will do a whole lot better. Yeah.
Okay.
Okay, thank you very much, everybody. Please go to the website. Thanks.
Thank you.